is the fracture healing. So the stages of fracture healing, they are given by a scientist called Frost. According to this, there are 5 stages. So the first stage is the stage of hematoma that lasts for about 7 days. Here the blood leaks from the torn vessels that will lead to hematoma formation. The fracture ends with necrosis and sensitization of the precursor cells take place. And the next stage is the stage of granulation from 2 to 3 weeks. There is a proliferation and differentiation of the daughter cells, formation of the blood vessels, fibroblasts can be seen, and a fracture over here is still mobile. Then the next is the callus stage, which is from about 4 to 12 weeks, it is about 1 to 3 months. Here, the mineralization of the granulation tissue takes place, a woven bone formation can be seen, and this is first visible on the X-ray about 3 weeks. Fracture clinically united. There is no mobility present. Now, either it can be a atrophic non-union where no callus formation, or hypertrophic non-union where there is a lot of callus formation. So these can be the abnormalities in this stage. Then the remodeling stage. So remodeling stage is for 1 to 2 years, where the woven bone, it gets converted into lamellar bone. The callus becomes densely and sharply defined. And the last is the modeling phase. Modeling phase happens after many years, where endosteal and periosteal modeling takes place, and the fracture site becomes indistinguishable from the parent bone. It becomes exactly the same. So there are 5 stages: hematoma phase, then the granulation tissue stage, callus formation, remodeling, and modeling. Then the next, the healing of the cancellous bones. In cancellous bones, the union occurs directly between the trabeculae. There is no medullary cavity and large contact area is present. Now, there are two different types of bone healing: as primary bone healing and secondary bone healing. Direct bone healing without callus inoperatively treated fractures with rigid fixation, that is called as primary bone healing, where there is no callus formation, and secondary bone healing is healing with callus formation. It is seen in non-operative environment. Then factors affecting the fracture healing. So there are multiple factors. There can be patient related, fracture related factors. So first, talking about the patient related factors. In the patient related factors, age. In the children, there is a faster healing. So callus, which is usually visible on the radiology on 3 weeks, and which is pathologically, which is clinically understood by 4 to 12 weeks. In children, it can be visible at 2 weeks itself. In adults, there is a slower, and in elders, there is even a delayed healing. In case of systemic illnesses like malignancy, osteomalacia, there can be further delayed union. Then fracture related factors are the type of bone. If it's a flat bone or cancellous bone, then they unite faster than the tubular or the cortical bones. Then the pattern of fracture. So the spiral fracture, that is caused because of twisting injury, they have a faster speed of union as compared to the transverse fracture, where there is a transverse cut. And comminuted fractures. In comminuted fractures where multiple fractures are seen, slow healing is present. Then open fractures. Open fractures, they are prone for delayed union because of communication with external environment. Bone loss. If there is a gap, then that will lead to non-union of the bones. Talking about the blood supply. So bones with poor blood supply, that is the scaphoid or the neck of femur, then lower tibia. In those bones, there is a slow union. It can lead to avascular necrosis and non-union are the complications of this. Soft tissue interposition, it prevents the callus bridging, that can lead to non-union, and infection. Osteomyelitis will lead to delayed or non-union. Next are the treatment related factors. The treatment related factors are the reduction. If there is a good reduction, if good opposition of the two ends of the bones is done, then that will lead to faster union. Immobilization. If the patient practices adequate immobilization, then the fractures heal good. And inadequate immobilization, this is one of the most common cause of non-union. Then distraction at the fracture site. If there is any kind of distraction, then that will lead to delayed union. Compression. In compression of the two ends, it enhances the union in cancellous bone. In cortical bone, the rigidity may cause primary healing, that is without callus formation they may heal. Internal fixation. Rigid internal fixation will lead to primary healing and no callus formation. Then what are the markers of bone healing? So in the lab investigation, there are bone formation markers and the bone resorption markers. So the bone formation markers, they include the bone specific alkaline phosphatase, ALP, osteocalcin, and serum peptide type 1. These are the bone formation markers. In the bone resorption markers, N-telopeptide, C-telopeptide, and the urine total deoxypyridine. So these are the bone resorption markers. Osteocalcin, ALP, and serum peptide type 1 are bone formation, and the bone resorption are the N-peptide, C-telopeptide, and free uh, deoxypyridinolene, which is found in the urine. The boner is option mark.